In today's medical environment, with growing caseloads and the trend toward less invasive procedures, providing effective cardiac output monitoring is becoming more demanding than ever. Current technologies are invasive, face challenges in accuracy, or both, and require highly skilled staff.
With heart failure being also the #1 reason for hospital admission in the Western world, there is really no robust, scalable way to measure cardiac function.
The goal is to provide physicians with a tool to take better care of their patients.
Now there's a new and effective real-time, non-invasive cardiac monitoring system for every beat, every patient, everywhere. CHEETAH Medical presents NICOM. NICOM provides a highly accurate, simple-to-use, cost-effective diagnostic modality. With just 4 single-use electrodes to attach, cardiac output monitoring can begin within minutes. The user-friendly NICOM workstation analyzes and presents the results and stores them for future reference. The key to NICOM's non-invasive cardiac output monitoring is CHEETAH Medical's proprietary bioreactance technology.
We basically build on the discovery that during the cardiac stroke, there's also a very small but measurable change in the phase of a radiofrequency current that you apply to the body.
Frequency changes and amplitude changes in those signals as they traverse the thorax are related to the amount of blood flow in the aorta, and that's really what is being analyzed.
500 times a second, NICOM's 4 double electrodes emit low-level electrical currents. Reflected by the aorta, their frequency or phase is slightly altered. Based on these changes, NICOM generates a highly accurate picture of cardiac output for individual heartbeats or a per-minute average. NICOM's hybrid technology combines bioreactance with bioimpedance, providing 3-lead ECG and thoracic fluid content readings along with cardiac output. As a result, even in challenging clinical situations such as ECG under stress, NICOM provides real-time, continuous tracking of patients' cardiac output and other key parameters such as ventricular ejection time, heart rate, and cardiac contractility.
The goal is to be able to anticipate those times when they're going to get into trouble, to intervene early so that we can prevent hospitalizations.
Various NICOM configurations bring non-invasive cardiac output monitoring to the widest range of environments, from the emergency room, operating theater, intensive care unit, and dialysis clinic to the physician's clinic and even the patient's home, without the need for sophisticated training.
We are able to make a measurement in a setting where it would never be done before.
Clinical studies on some 1,000 patients demonstrated NICOM's outstanding performance and accuracy in cardiac output monitoring.
Being able to expand the monitoring of cardiac output to a very large audience brings more insight into these patients and hopefully will enable better care, faster recovery with hardly any addition to the costs.
Continuous, non-invasive cardiac output monitoring with NICOM, an invaluable source of information to intensivists, cardiologists, and anesthesiologists, empowering clinicians with a window to the heart, every beat, every patient, everywhere. From CHEETAH Medical, NICOM.